Yes, now.
Okay. I forgot what nbme was that. I think it's 12, but not sure.
Yes, it's
I know you told me to open one yesterday. I just don't remember. Yeah. Okay. So how you want? Like I read the question and read the
then
answer.
I can explain. Yes, we
Okay.
can do that.
27-year-old man with ulcerative colitis comes to the ED because of a 3-day history of moderate abdominal cramps. Oh, I cannot highlight it here. Oh, I can. Okay, sorry. Uh, ulcerative colitis. Okay. Bloody diarrhea. His medications are mesalamine, azathioprine, whatever. His temperature is high. Abdominal exam shows mild distension. There is mild diffuse tenderness to the palpation, but no tenderness to percussion. Flexible sigmoidoscopy shows red mucosa with scattered ulcerations throughout. Colonic biopsy results show several giant cells with inclusion bodies. Which of the following is the most appropriate next step?
Okay, it's CMB. So cytomegalovirus. So ganciclovir is the answer. Okay, why CMB? Okay, CMB is known as the human herpes virus 5. Is an opportunistic pathogen that commonly causes disease in the immunocompromised patient in the setting of severe ulcerative colitis. This patient has ulcerative colitis because there is bloody diarrhea and patient is on mesalamine and azathioprine, isn't it? Okay.
Mm-hmm.
And ulcerative colitis, solid organ or allogenic bone marrow transplantation or HIV or AIDS or HIV or AIDS. It can be transmitted through multiple nodes, including sexual contact, urine, respiratory droplets, and to a fetus via placenta. To a fetus via placenta. Disease manifestation include colitis, retinitis, esophagitis, encephalitis, mm, esophagitis, encephalitis. Where I am. Okay,
Right here.
esophagitis. Yes, pneumonia. The classic histologic finding of CMV infection are mononuclear cell infiltrate with giant cell showing prominent intracellular inclusion body. So our key point is a giant cell with intracellular inclusion body, giant cell and intracellular inclusion bodies. So that's why CMB. Okay, treatment for all HH herpes virus includes drugs that inhibit viral DNA polymerase, classically by using guanosine analog like acyclovir, valcyclovir, famciclovir. Mm, Prior to their exerting their antiviral effects, most guanosine analogs must be phosphorylated by the viral enzyme thymidine kinase, and CMV does not have the necessary thymidine kinase for phosphorylation of most common guanosine analog. However, it does not have the necessary phosphorylating enzyme to activate ganciclovir. So, administration of the ganciclovir is the most appropriate next step for in the treatment for this patient with CMV colitis. So for this patient with CMV colitis, ganciclovir is the drug of choice. We are not giving hydrocortisone. Why? Hydrocortisone is for acute flare, symptomatic flare for ulcerative colitis or due to induced remission in disease refractory to initial therapy, the corticosteroid one. So in here, there is specific like CMV infection, which is confirmed by colonic biopsy. There is giant cell with inclusion body. That's why ganciclovir and acyclovir is not the drug of choice in here because acyclovir is not sensitive for CMV infection. and we are not doing the total colectomy. A total colectomy can be indicated in the treatment of refractory ulcerative colitis with ulcerative colitis with wait, ulcer. We are not. Total colectomy can be indicated in the treatment of refractory ulcerative colitis and ulcerative colitis with toxic megacolon or refractory CMB colitis. Okay, in toxic megacolon there is a sign
Mhm.
that is it use coffee bean shaped. Is the toxic megacolon is the coffee bean shaped?
Is it or is it the sigmoid one? That's I think the sigmoid one is the coffee
The
bean,
sigmoid volvulus,
right? Or
and then
no?
the toxic megacolon. What is its? Is there any characteristic feature of toxic
I
megacolon?
don't think so. I don't think so. I think it's the it will say there is a rigidity and whatever to rigidity and guarding, but I don't think it's the.
Okay,
Let me check. Oh, what is my Google?
okay. So according to educational objective, like CMB is an
Mm-hmm.
opportunistic pathogen that commonly causes disease in immunosuppressed patients in the setting of severe acute ulcerative colitis, solid organ or allogenic bone marrow transplantation, or HIV/AIDS. So disease manifestation include colitis, retinitis, esophagitis, encephalitis, and pneumonia. And intracellular inclusion body are classically observed on histologic examination. First line is ganciclovir. CMB colitis, ganciclovir. Okay,
A coffee bean shape is sigmoid volvulus.
okay.
Okay. Next.
So coffee bean sigmoid volvulus.
47 men come to the physician because 3-week history of increasing rectal bleeding. The bleeding is bright red and initially occur only during bowel movements, but now occurs between bowel movements. He loses approximately 2 teaspoons blood daily. His stools are formed. He has not had diarrhea or pain. He has receptive anal intercourse with one male partner. They use condom consistently. Since bleeding began, he has abstained from having sex. He has no history of similar or serious illness. Takes no medication. There is no family history of serious illness. The patient appears well, vital signs normal. Visual exam of the rectum shows no abnormality. Digital exam shows no palpable mass tenderness or swelling. Test for a stool for a cord blood test is positive. Which of the following is the diagnosis? Ow.
Okay, in this stem, like test for occult blood test is positive and bright red blood. Mm, there is no pain. Is there any pain?
Mm-hmm.
Okay,
No.
so no pain. So looks like internal hemorrhoids. Okay, hemorrhoids result from dilated submucosal vein in the anal canal. They are commonly classified as either internal or external based on their relation to the pectinate line of the anal canal. Internal hemorrhoids are typically painless. Internal hemorrhoids are typically painless, and because of their visceral innervation to the proximal to the pectinate line, while the external hemorrhoid is somatic innervation distal to the pectinate line, distal to the pectinate line, somatic innervation, and it is painful. Mm, While hemorrhoids can result in bright red blood from the rectum, bleeding is generally mild. The patient's symptoms are most likely due to internal hemorrhoid, which causes mild painless rectal bleeding. Prolapse internal hemorrhoid are offer as a red or purple mass protruding from the anus during defecation. If severe, hemorrhoids may remain prolapsed or following bowel movement, requiring manual reduction. If refractory to the conservative management placement, constricting bands is used. in the ligation of the internal hemorrhoid. This results in diminished blood supply to the hemorrhoid and subsequently becomes necrotic to slough out. Okay, rectal prolapse is also painless. So why we are not thinking about rectal prolapse?
I think there will be a mass rectal prolapse.
Yes,
It
rectal
says
prolapse is like red and pink mass protruding from the anus during or after defecation, and it is also painless if it is not reduced. If not easily reduced at the bedside, sometimes require operative reduction during anesthesia. The patient has no palpable mass. Okay, if we find the palpable mass and like this feature, so rectal prolapse may be the one of the option. And rectal condylomata is condylomata acuminatum like condylomata acuminatum HSB 1 to 4.
HSV. Mm,
Genital word is the
genit.
genital.
No, I thought genital was. No, it's not. It's not 16, 18. It's the
No,
the
yes,
one in the
it's
middle.
not 16, 18. I know that. Is it
It's
6, 11?
it's 611, right?
Yes. 1 to 4
Okay.
is like genital word.
1 to 4. No, 1 to 4 is the hand. Oh my God, it's the baby. I remember from sketches like the baby that are outside. Oh, or am I
Like
getting it wrong? Like the hands and the body, or
HH,
no?
uh, HPV 1 to 4. You are talking about this?
Mm. HPV 1 to 4. Yeah. Let's
I don't
see.
remember like this.
I remember
Like 1 to 4 is, as far I remember, it is genital wart, and 6 to 11 is condyloma acuminata, and 16, 18 is actually the cervical cancer.
60. Yeah. Okay, so
Okay,
1 to 4. Yeah, you're right. No, yeah, 611 is the genital one.
and
Let me
1 to 4.
see. 1 to 4 cutaneous. So in the body, in the fingers, in the hands is right here. Fingers, hand, plantar, and then 611 is the
It
larynx.
is also known as condyloma. It is laryngeal papilloma as well as condyloma acuminata. Look at the
Is the 6 and 11 is the one that is laryngeal papilloma. You see, that's
yes,
why it's putting it in the mouth.
is it's laryngeal papilloma. Yes, I got it. Go downwards on that explanation. Like
Which one?
yes, this one is
Mhm.
it if affects the infant and STD adults, also causes pill bugging down his pants, aka condyloma acuminata. 611 genital words.
Yeah, so 611 is the throat
The genital.
and the
So,
genital.
611 is laryngeal papilloma along with the condyloma acuminata, and 1 to 4 is the wart, genital like plantar wart or other wart like
Mm-hmm.
lesion, maybe in the finger, maybe in the other area. Okay,
Mm-hmm. Okay.
okay, got it.
Okay. Next.
Yes,
26 women brought to the ED 2 hours after the sudden onset of severe abdominal pain and fainting. She has no other serious ills. Abdominal pain and fainting. She has no other serious illness and she takes no medication. Last menstrual period was 6 weeks ago. Temperature is normal. Pulse is high. Respiration normal. It's not working now. Yeah. Blood pressure low. Pulse oximetry on room air is 98. Examination shows no jugular venous distension. Breath sounds are fine. Cardiac exam is fine. Abdomen shows mild distension and diffuse tenderness with guarding and rebound. With there is 1+ pedal edema bilaterally. Results, lab results, hemoglobin, I believe that's low. Hematocrit must be low too. Leukocyte is high. Platelet is normal. Serum, I believe that's high. Sodium. Yeah, it's a bit high. Potassium is normal and beta HCG
is
is
high.
high. Yeah. Transvaginal ultrasound shows no intrauterine pregnancy. Which of the following is the most appropriate next step? No intrauterine.
So no intrauterine pregnancy looks like ectopic pregnancy as beta HCG is high, no intrauterine pregnancy, and her last menstruation is 6 weeks ago, missed menstruation, isn't it?
Yeah.
Okay,
Yeah.
so it's look like ectopic pregnancy. Okay,
Mhm.
so pregnancy is suspected when a patient experiences missed or delayed menstruation, menstruation. Ectopic pregnancy is often presents with symptoms including lower quadrant abdominal pelvic pain, vaginal bleeding, nausea or vomiting. An ectopic pregnancy An ectopic pregnancy is an abnormal pregnancy in which fertilized ovum implants, most commonly in the uterine or fallopian tube. Less common in Less common implant sites include peritoneal cavity, or non-endometrial location. Risk factor of ectopic pregnancy is in vitro fertilization prior PID. In vitro fertilization prior PID. Is there any risk factor present in this patient?
No.
No.
I mean, it didn't say. They didn't say.
Okay. In vitro fertilization prior PID and STD. Rupture of the ectopic pregnancy can lead to hemoperitoneum and hemodynamic instability as seen in this patient if undiagnosed or severe. If undiagnosed or severe, it can lead to syncope and hemorrhagic shock. Ectopic pregnancy is non-viable. Ectopic pregnancy can be managed medically with methotrexate especially for early pregnancy, but may require salpingectomy. Or evacuation of or evaluation with laparoscopy for larger pregnancy in case medical treatment failure or in case of complication. Is there any like timeline where we are not able to use methotrexate? I think there is. Like if
They
yes,
I think it's just if the person is unstable, you go. Like usually, the question I've seen is they will give you either the patient is stable or unstable. If
yes,
she's unstable, then you go straight to surgery.
surgery.
If she's stable, then I think you do the method. Wait, you
But
do the method correctly, right? Yeah.
yes, that's I am talking on. Like we can use methotrexate, but beta HCG should be lower.
Beta HCP should be lower.
Beta
Okay.
HCG should be, as far I remember, like beta HCG
Mm-hmm.
should be below 3000, but it is way above. It is
Mm-hmm.
above 3000. So I don't think that we can give methotrexate at this patient.
Do we give methotrexate and misoprostol when the pregnancy is ectopic?
No, no.
No.
You are talking about the kit like methotrexate, sorry, mifepristone and misoprostol, isn't it? Like for abortion. Or you are,
Yeah, like
yes.
like
It is not for ectopic pregnancy. It
no,
is
right?
for like early pregnancy patient do not want to continue the pregnancy. Then this kit like mifepristone and misoprostol is given, but not
Mm-hmm.
methotrexate. Okay, there is a flow chart in the USML inner circle. Like
Mm-hmm.
if it is non-diagnostic, serum mm, serum beta is CG. Wait, where? Okay, methotrexate. Uh, this is the diagnostic part. Methotrexate. Okay,
Mhm.
in the USMLE inner circle, there is methotrexate is contraindicated in patients with hepatic disease or renal disease like diabetic nephropathy due to decreased clearance and uh, slower drug metabolism and increase the risk of methotrexate toxicity.
Okay. Okay. Okay.
Okay, there is I'm not getting the specific timeline. Just there is diagnostic approach like if serum beta hCG is more than
Yeah,
3500.
I saw that one.
Yes.
Yeah. Mm. Okay. I feel like I saw methotrexate for something. I just don't remember what it was. I just don't remember.
Okay.
Okay. Next.
Okay.
10-year-old girl brought to the office by her parents because of a 3-year history of impulsive and inattentive behavior. Her parents had been trying to manage her behavior at home and school, but during the past 6 months, she has had marked decline in function at school and extracurricular activities. She has been in trouble for being disruptive and not following instructions. She has no history of serious illness and doesn't take medication. Growth and developmental are fine. Physical and mental status show no abnormality. Without treatment, this patient is at greater risk for which of the following?
Okay. Okay. This is ADHD. Like ADHD presents with chronic symptoms like hyperactivity or impulsivity or inattention in inattention that occur in more than one setting that impair the academic, social, or emotional function. Children with predominant hyperactivity symptoms are unable to symptoms. Children with predominant hyperactivity symptoms are unable to sit still and may have difficulty taking turns, postulated to result from dysregulated dopamine reward pathway, where children with predominant inattentive symptoms tend to daydream, process information slowly, demonstrate difficulty in completing tasks related to norepinephrine dysregulation, and difficulty with impulse control commonly leads to emotional dysregulation. There is increased rate of substance use disorder in children and adults with ADHD compared to those without the condition. Researchers have theorized that individuals with ADHD may self-medicate with substance to help to regulate their emotion or improve attention. Stimulants like amphetamine salt, and methylphenidate are, are the first line drugs. Methylphenidate are the first line drugs on that increase the synaptic dopamine and norepinephrine. Okay, why it is not a generalized anxiety disorder? Generalized anxiety disorder is commonly comorbid in patients with ADHD. Early ADHD symptoms may predispose an individual to an anxiety. However, the correlation between ADHD and substance use disorder is more firmly established than the generalized anxiety disorder. Is there any option you want to you want me
No,
to read?
no, I think this was just we need to know that the ADHD is associated with
With
substance use.
substance, yes.
Yeah, it's just a fact that there's no, yeah, we need to know.
Okay.
Okay. 8-year-old boy brought to physician by his mom because he has had a rash shown for a week. The rash shown here for a week. The rash began as a small 1 centimeter lesion on the cheek. His younger brother has had a similar rash for 5 days. The patient had an upper respiratory tract infection 8 days ago, treated with over the counter decongestant. Temperature is fine. Which of the following is the most likely explanation of these findings? What is this?
According to picture, what is your diagnosis? It is honey crusted lesion, isn't it?
Honey crusted lesion. Yes.
So it's impetigo.
Mm-hmm.
So impetigo caused by the bacteria, usually staph. Okay,
Mm-hmm.
okay. So this patient, bacterial infection in case of impetigo, bacterial infection in case of impetigo is a contiguous superficial skin infection. Contiguous superficial skin infection caused by staph aureus. Impetigo is common among young children but also occurs in adults. Impetigo is often localized to the sites where there is breakdown of the normal skin barrier condition like atopic dermatitis. Impetigo may be benign or as superficial vesicles or pustules that spread locally. Rupture of the vesicle and pustules may lead to development of erosion with overlying adherent honey colored crusting. Mm, Systemic involvement is uncommon in patients with impetigo. Bacterial culture and sensitivity testing may be obtained to further determine the causative pathogen and to guide the antibiotic. In impetigo, topical antibiotic like mupirocin and in severe cases oral like cephalexin or clindamycin. Okay, pickle, mupirocin, and cephalexin and clindamycin for severe.
Okay.
Okay,
Next. 16-year girl comes to the office for routine exam. She has no history of serious illness, no medication. Menarche was at 12. Menses occur at irregular, like 28 to 34-day interval with live flow. Last menstrual period was 10 weeks ago. She participates in after school sports, including soccer track, and receives, I guess, good grades. She appears well groomed, affable, and engages readily in discussion. She's 5'6" and weighs like pretty low, 112. BMI is a bit low, 18. Temperature is fine. Pulse is fine. Blood pressure a bit low. Sexual maturity, final stage 4 for breast and pubic hair development. Which of the following is the next step?
okay. So this patient's secondary amenorrhea caused by pregnancy, menopause, or premature ovarian failure, ovulatory dysfunction, abnormalities of hypothalamic pituitary ovarian axis, inadequate nutrition, chromosomal abnormalities, and uh, thyroid disorder. Is there any risk factor present in here?
No, really. I mean, yeah, the BMI and the after school that she exercise a lot and whatever. Yeah, I guess that's one.
BMI is 18, not like anorexia level, but he's exercising a lot. That may be okay. Okay, you are talking about like prolonged exercise causing the menstrual irregularity. That one.
Uh-huh, uh-huh. That, I mean, that would be a way to, yeah. Yeah.
Yes.
Mm.
Okay. So a careful history should be taken, including a careful history should be taken. Uh, okay, my mom is calling. 1 minute.
Okay, go ahead.